Welcome to our podcast on diabetes mellitus. To start, can you clarify what diabetes actually is, beyond just high blood sugar? Many people oversimplify it.
Absolutely. Diabetes mellitus is a group of metabolic disorders where the body struggles to regulate blood glucose due to defects in insulin secretion, insulin action, or both. This leads not just to high blood sugar, but also disrupts how the body handles carbohydrates, fats, and proteins.
That's a great clarification. Now, diabetes isn't just one disease, right? How do we classify its different forms? And what are the main distinctions?
Correct. Diabetes is mainly divided into type 1, where autoimmune destruction leads to an absolute lack of insulin, and type 2, which involves insulin resistance and gradual insulin deficiency. There are also specific types, like those caused by genetic mutations or pancreatic diseases, and gestational diabetes, which first appears during pregnancy.
That's quite a range. For a quick analogy, could we say type 1 is like having a car with no fuel injection? While type 2 is more like a car with clogged filters? The fuel's there but can't reach the engine properly?
Exactly. That analogy works well. In type 1, the pancreas can't supply insulin at all, like a missing part. In type 2, the body becomes less responsive to insulin, similar to a blockage that keeps the fuel from working efficiently.
Let's transition to the global impact. Diabetes rates are skyrocketing, especially in countries like India. What's behind this sharp rise, and which type is most prevalent?
Type 2 diabetes is responsible for about 90 to 95% of all cases, and its prevalence is increasing worldwide due to factors like rising obesity, physical inactivity, and longer lifespans. Urbanization and processed diets also play major roles, particularly in developing nations.
And what about the root causes? Could you walk us through how each type develops on a biological level?
Certainly. Type 1 diabetes stems from an autoimmune attack targeting pancreatic beta cells, often linked to specific HLA genes and autoantibodies. In contrast, type 2 diabetes is a result of insulin resistance where muscle, liver, and fat cells don't respond properly to insulin, coupled with progressive beta cell dysfunction.
That interplay between genetics and environment seems crucial. Are there any statistics or studies illustrating this trend? Or highlighting key risk factors?
Absolutely. For instance, the International Diabetes Federation estimates over 500 million adults globally have diabetes, with India leading as the so-called diabetes capital. Studies show that obesity, especially central obesity, and a sedentary lifestyle are the most significant modifiable risk factors for developing type 2 diabetes.
Moving on, let's discuss how diabetes presents itself. What are the hallmark symptoms, and are there differences between type 1 and type 2?
The classic symptoms are polyuria, polydipsia, and polyphagia, meaning excessive urination, thirst, and hunger. Type 1 often starts abruptly with weight loss, while type 2 can be silent for years, sometimes detected only during routine health checks.
That's interesting. So many might have type 2 diabetes without even knowing. How is diabetes formally diagnosed, and what tests are considered reliable?
Diagnosis relies on blood tests. Fasting plasma glucose over 126 mg DL, a 2-hour glucose tolerance test over 200 mg DL, an HbA1c above 6.5%, or a random plasma glucose over 200 mg DL, with symptoms. These criteria help catch both overt and hidden cases.
How do these tests compare in terms of accuracy or practicality? For instance, is HbA1c useful everywhere?
HbA1c is convenient because it reflects average glucose over 2-3 months and doesn't require fasting. However, it can be unreliable in conditions affecting red blood cells, like anemia. That's why clinical context and sometimes repeat testing are important.
Once diagnosed, managing diabetes becomes a lifelong process. What are the pillars of diabetes management, and how do they differ between types?
For type 1, insulin replacement is non-negotiable. Patients need lifelong injections. Type 2 management starts with lifestyle changes like diet and exercise, followed by medications such as metformin. Over time, additional drugs or even insulin may be required if control wanes.
What about monitoring and preventing complications? How do patients and clinicians keep diabetes in check over the long haul?
Regular self-monitoring of blood glucose and periodic HbA1c tests are key. annual screening for eye, kidney, and nerve complications is also vital. Patient education empowers individuals to recognize warning signs early and adjust their routines accordingly.
Prevention is often better than cure. Are there proven strategies for preventing diabetes, especially in high-risk groups?
Absolutely. Lifestyle interventions like adopting a fiber-rich diet, reducing refined carbs, and exercising at least 150 minutes weekly can reduce type 2 diabetes risk by over 50% in high-risk individuals, as shown in the Landmark Diabetes Prevention Program study.
To wrap up, could you share a real-world example of successful diabetes prevention or management?
Certainly. Finland's diabetes prevention program showed that community-based lifestyle coaching led to a 58% reduction in new cases among participants. It highlights that with the right support, diabetes doesn't have to be inevitable or unmanageable.